Hi, my name is Dr. Edwin Salsitz. I'm an addiction medicine specialist, and I work at Mount Sinai Beth Israel in New York City. Today I would like to take 3 minutes to talk to you about urine drug testing. And the comments I'm going to make are based on a presentation that I gave at the Pain Care for Primary Care Conference in Orlando, Florida. Number one, I would say that urine drug testing or using other bodily fluids such as saliva has become a standard of care, is recommended by all guidelines, whether they're addiction guidelines or pain care guidelines, and they should be performed on any patient who is receiving controlled medications. They should be performed at baseline before the medications are started, and then they should be randomly performed periodically. No one has an exact number of how often to do it. That should be based on clinical judgment, and it should always be random. Second point is that sometimes urine drug testing results are complicated and not clear. There can be false positives, there can be false negatives. Particularly around opioids, one has to learn and understand opioid metabolism. So for example, somebody taking morphine may metabolize that morphine to hydromorphone, or somebody taking oxycodone, they may metabolize it to oxymorphone. And unless you understand how the opioids are metabolized, you might think that someone was doing something that was problematic, whereas the explanation is as simple as it's just the metabolite of the medication which you are prescribing. And the third point, which I think is the most important point, is that the purpose of doing urine drug testing is to help the patient. We are trying to use it as a therapeutic, objective modality, see what the patient is taking or not taking, and then if anything is not normal in the findings, it is an opportunity to open a discussion with something like, Mrs. Smith, can you please tell me why there is no oxycodone in the urine when you are prescribed oxycodone? And there may be some reasonable, innocent explanation for it, such as, well, I ran out early and I couldn't refill it and my insurance expired. Another good setup is to ask patients to tell you what is going to be in the urine before you even check it. And I think if you set up a paradigm where they are certain that you will not do anything drastically negative to them if they tell you that they used, let's say, cocaine on the weekend one time, it would be best if they could just say that to you and then you could verify it with the urine test.